Amolata district has registered a 44% decrease in health workers' absenteeism from 50% in 2015 to 6% presently. The reduction is attributed to the Human Resources Information Tool introduced in the district by the government in 2015 to curb absenteeism of workers in health facilities. The project, implemented by IntraHealth with support from USAID, has made a tremendous transition from a paper-only filing system to an electronic human resources information system capable of providing information about specific health workforce questions in the district. Alex Guom, the Assistant Records Officer for the district, says he's now able to prepare analytical data for the 141 staff working in 11 health facilities.
They pick the information from the duty roster, arrival book, and then the request file. That's mean out of station. Then they make the conclusive data. So at the end of the month, it will be submitted with the 105 HMIS to the Biostat. So from there we pick our report on attendance, then we capture to the HRS system.
Guom also says this system is accessible via the internet and it helps him to provide timely reports to the district health officer.
So now I am after now data quality, timeliness, completeness, accuracy, and then the transparency.
In 2015, a study by IntraHealth revealed that 50% of health workers in Uganda's public sector were not showing up or came to work but left early to collect dual pay at another facility. The Assistant District Health Officer, Dr. Alex Ogwal, says the system has been vital in many ways, including identifying the absent workers, knowing why they did not show up for duty, and also planning for the staff.
Right from the appraisal form, that is performance planning. Now they know because we have taken the in-charges through the performance planning. The tool also has helped us in tracking those who are due to exit service. The system reminds you, because you can just print, say, how many people are due to exit service in the next 5 years. Then the system will generate for you.
Nakatiti Health Center 2 is one of the facilities embracing the use of this monitoring tool. The in-charge here, Teresa Peduni, works with 6 colleagues. She is happy about the tool because it has helped to instill discipline at the facility.
It has always sometimes been challenging in a way that when we try to be hard on the staffs, they also sometimes be hating us. But no matter, we sit down and then try to explain to them why it is important to do it that way. And they have also understood it.
Assistant DHO Dr. Ogwal also says the system requires to have additional staff and more equipment for efficiency.
Because now, we have the computer all right, but we have been crying, we wanted the Wi-Fi around so that it covers some area maybe, so that we house this place as a central place for managing human resources in the district.
The Chief Administrative Officer who supervises service provision in the district says he intends to pilot the monitoring tool to other sectors due to its efficiency.
There was rampant absenteeism and we're paying a lot for no work done, okay, at the end of the month. Find a staff appearing only about 5 times or 10 times in a month, okay, but paying for the rest of the days that they are not even working. But now that they have reduced, the system has made the people, the staff to feel that the machine will detect your absenteeism and you will be paid according to the days attended to. That thing has generally made us pay for work done.
As an organization, Vincent Okecho, the chief of party at IntraHealth, says the organization is helping to enhance the implementation of government plans and therefore it should be ready to take over the program once it winds up next year.
When it is linked with other systems to become more robust and therefore more likely to be supported and sustained.
Okecho reckons that their period of operation in 122 districts in the country will leave a remarkable difference in service provision in the health sector.
We were able to display clearly how short we were in terms of health workers and made a case for increased investment in recruitment of health workers. and the government was able to find additional 49 billion shillings, which we used to recruit 7,211 health workers across the country in all districts. And this grossly improved the staffing levels, especially at health centers 3 and 4.
Walter Mwesije, NTV.